So how do we treat an enlarged prostate, or BPH? BPH is the medical term for an enlarged prostate. It stands for benign prostatic hyperplasia. Well, there are several different ways to treat an enlarged prostate gland. These include medical therapy, surgical therapy, or more recently, laser. Medical therapy involves taking tablets, and usually it's one tablet once a day. The tablet aims to relax the muscle, the smooth muscle, at the junction between the bladder and the prostate, and also in the urethra, or the pipe that comes from the bladder and is within the prostate, to relax that muscle there. Now, the advantages of this is that it can improve a man's flow and improve a man's symptoms. The downside is that you need to take one tablet once a day, and that continues for a long period of time. In certain circumstances, another tablet can be added, something called finasteride or Proscar. What that tablet tries to do is to shrink the prostate. The way it does that is by switching off or preventing the conversion of testosterone, the male hormone, preventing it from being transferred or modified to its active form. We know that if men do have Proscar or finasteride, it can shrink the prostate, decrease a man's PSA, and can have an impact with regards disease progression. And what I mean by disease progression is that it affects how symptoms change and progress with time. And it's that combination of medical therapy that is the only combination that's been shown to have an impact with regards to disease progression. If you have what's called an alpha blocker, the smooth muscle relaxant, that will not change disease progression but will control your symptoms. Obviously, medical therapy means that you miss out on having an operation, which is an advantage. However, the downsides are the potential side effects to medication and also the potential for the disease to continue progressing with time. So surgical therapies, as I said, includes something called a TURP or transurethral resection of the prostate, the Rebor operation. That's an effective operation at removing overgrown prostate tissue. It's performed by passing a camera through the eye of a penis and physically removing pieces of tissue in a piecemeal form from the prostate. The aim of that procedure is to create a large open cavity within the prostate to make it easier for a man to pee. The downside to that operation is that fluid that needs to be used to wash out the bladder during the procedure can be absorbed and dilute a man's bloodstream that can have an impact. In addition to that, there's a higher risk of bleeding with this particular procedure and a potential for damaging a man's erectile function. And in the literature, the incidence of erectile difficulties following this surgery has been reported between 5 to 18%. In addition, a catheter or plastic tube is inserted in through the penis into the bladder to wash out the bladder for a period of time. That usually stays there in most centres around 2 to 3 days, and a man will remain in hospital during this period and then be discharged. The alternative is to have laser treatment. There are lots of different lasers out there, and at the end of the day, a particular laser, the properties of a particular laser are dependent on the wavelength of a laser. I perform green light laser prostatectomy, which is a minimally invasive form of surgery to treat an overgrown prostate gland. The treatment is provided in a similar way to that of a TURP, in the sense that a small camera is passed down the eye of the penis and the prostate, the internal surface of the prostate, is visualized. Then, using a very fine fiber, we direct the laser onto the surface of the prostate and we vaporize it. That means that we turn the prostate tissue from solid into gas. The main advantage to this technique is that the incidence of bleeding that causes men trouble is very, very low indeed. As you can see, there's next to no bleeding at all. We've got clear runoff fluid, looking great. Clear runoff fluid, no bleeding, and this man will have his trial avoid, the removal of his catheter tonight at midnight, and will go home tomorrow morning after he has breakfast. I've performed over 200 of these operations now and have never had to transfuse one patient. In addition to that, the time that a man needs a catheter in place is greatly reduced when we compare that to the times needed for a TURP, and men spend a shorter period of time in hospital. For example, men that are less than 65 years of age, in my practice, are treated and discharged on the same day. And 90% of those men go home without a catheter. 10% of those men may require the catheter to be inserted again, just to allow the bladder to rest for an additional period of time. For men that are over 65 years of age, they stay in hospital overnight and are discharged the following morning without a catheter. The recovery time compared to a TURP is also far quicker. I advise men to take it easy for the next 3 weeks to avoid ejaculation, riding a bike or lifting anything heavy for that period of time, just to allow the surface of the prostate to heal nicely. What we see following green light laser surgery is that the obstructive symptoms, the flow, the hesitancy, the feeling that you're not quite empty, and the intermittent nature to the flow get better almost immediately. Then with time, the overactive bladder symptoms begin to settle. The frequency comes down, the urgency settles, and the number of times a man has to get up through the night also begins to settle down. In terms of the impact on erections, one of the advantages to laser therapy, green light laser therapy, is that the depth of penetration of the laser is less than 1 millimeter, and therefore the incidence of erectile troubles following this type of surgery in the literature is reported at less than 1%. So once again, that's a significant advantage over TURP. So these are the main treatment options for a man with an enlarged prostate.